This video will demonstrate the placement of the oropharyngeal airway, or OPA, when two providers are available. All esophageal airways require the patient to have no gag reflex. If the patient regains consciousness and begins to gag or vomit, these devices are removed immediately. Extubation of esophageal airways almost always causes vomiting or regurgitation. Consequently, suction equipment must be readily available when the device is removed. Observe standard precautions. The first provider brings the patient's head and neck into a neutral inline position and maintains stabilization while opening the patient's airway with a trauma jaw thrust maneuver. The second provider selects and measures for a properly sized OPA. The accompanying illustration shows a workable method for measuring the OPA. The distance from the corner of the patient's mouth to the earlobe is a good estimate for proper size. The second provider opens the patient's airway with the chin lift maneuver. The OPA is turned so that the distal tip is pointing toward the top of the patient's head and tilted toward the mouth opening. The second provider inserts the OPA into the patient's mouth and rotates it to fit the contours of the patient's anatomy. The second provider rotates the OPA until its inside curve is resting against the patient's tongue and holding the tongue out of the posterior pharynx. The flanges of the OPA should be resting against the outside surface of the patient's teeth.